So targeted therapies have absolutely changed the way that we approach and treat cholangiocarcinoma in the advanced disease setting, at least so far. What we now know is that the majority of our patients with cholangiocarcinoma, if they have the opportunity, should have next-generation sequencing or molecular profiling done. And we typically recommend that it's done right at the time of diagnosis so that we have that information. I always tell my patients I like to have a plan B, C, and D. So we start them on standard of care chemotherapy, obtain molecular profiling, and what multiple series have now demonstrated is that almost about a third to 40% of patients with cholangiocarcinoma have targetable mutations, so mutations for which we have drugs, either in clinical trial or off-label use. And so it absolutely has changed how we approach patients once they progress on standard of care chemotherapy. And there are a lot of clinical trials even looking at bringing targeted therapies to the front line in combination with chemotherapy or even as single agent, since that gives patients an opportunity to have something without a chemotherapy backbone. And those targeted therapies that are probably most widely studied so far are the IDH1 mutations, so IDH inhibitors. FGFR fusions are seen in our patients, and so FGFR inhibitors have a role, as well as a few less common molecular alterations for which we have drugs like HER2 new inhibitors, for instance.